Hey, what's going on, everybody? Mike here, doing another update video. I am 1 week post-op, and I'm glad to report everything is pretty much going as planned. It's going as well as it can be for having spine surgery a week ago. If you've been listening to any of the other or watched any of the other videos, just to refresh your memory. So I had a single level ACDF, which was C6-C7. That surgery was done on February 23rd, and it's March 2nd now. So exactly 1 week since the surgery. So on this video, I'll just kind of go through what I've experienced in a week's time and how things are going, and I guess that's probably it because there's not a whole lot much more to report. So it's definitely been a little bit of a roller coaster ride. And when I say that, not anything bad really, just, the thing is you got to wear this thing, this collar, pretty much all day. I can take it off to eat and to shower. And my surgeon said if I'm just sitting on the couch, I could take it off just to watch TV or something, but I haven't been. I've been wearing it all day unless I'm going to shower or eat. So it's on for quite a long time. And honestly, I'm getting more used to this. Throughout the day, it doesn't bother me because it's a good reminder of keeping everything straight, right? You got to turn with your shoulders, so you can't really like move your head in a bad direction. It keeps everything kind of nice and in place. Doesn't mean you still can't tweak something, because I've done where I've moved my head to the side. Don't ask me why, and that's kind of hurt on the side of my neck. But you can't, your chin can't go down. If you start going down, everything goes down. So that's the main thing they want to make sure, is that you're not putting your chin to your chest. So with this on, you just can't do it. Other movement is okay, I guess, side to side and up. Just not a regular basis, but if you did do it when you had the collar off, it's not that huge of a deal. So I think I said it on the last video. Sleeping is still kind of a pain. You have to sleep on your back, and I'm not a back sleeper at all. I'm a side sleeper. So I've got a little bit of a routine going on. I've got 3 different spots that I can sort of sleep in. And when I say sort of sleep, it's like maybe I can get an hour, hour and a half, 2 hours max in one position. Then I got to get up and move to my next position. And so that's just something to think about. If you're not a back sleeper, I don't know what else I could have done, but maybe something for you to think about if you're going to get this surgery done. If you have a recliner, that definitely helps. I have one in my media room. It's not the best recliner, but it is a recliner, and I still can't really sleep in it, but I feel like I can get the most comfortable in that chair. And again, it lasts about maybe 2 hours, and then I'll wake up and I'll have to get out of there. So I've got my 3 stations. I've got the recliner that's up in my media room, so I have to go upstairs to get to that. I've got 2 sides of my bed. One side has wedge pillows. So I bought a wedge pillow kit. I know I keep saying I'm going to put that in the, I'm going to put the links in on the video, and I'll try to do that. It's a pretty nice wedge pillow kit. It's like a 5-piece one, so you can sit 45-degree angle with a piece under your legs. You won't be able to do that right away. It took a few days before I could actually lay fully back on this because the shoulder pain that you're going to have, shoulder and traps, and I still have some of that. We'll talk about that in a second. But that's one option. You can do a wedge pillow kit, and that way you can prop yourself straight up if you want to. You can do a bunch of different things, and it's worth the money. It was probably like $85 or something, $90. Definitely worth the money. I could see me using that in the future just to take care of my lower back. And then I've got a other side of the bed where I can lay flat, and to do that you got to have like a fairly flat pillow. You don't want like a big puffy pillow. Flat pillow. Get yourself a towel so you can adjust the back of your head, put it behind your head, and then you got to have a pillow under your knees. They want you to have that kind of elevated just a little bit. Again, no big pillows there. You can look up some videos on that. But I have that set up, and And that I can only lay in for, again, an hour and a half, maybe max. I'm not a back sleeper. The problem for me is I'll cut off my breathing tube because my tongue will fall back and it'll just block it, and then I'll end up waking up gasping. So it's pretty miserable, actually. But I'm gonna have to deal with it for really the next month, I think, before I can sleep on my side, as far as I know. So also with those three options, like maybe, look at your situation. Again, if you have a recliner, it's probably your best option, but I don't know if you're like me, you won't be able to stay in that all night. So you might you might want to have at least a second option so you can just alternate. So my routine is I lay in one, like maybe I start laying flat, then I'll get up, go to the bathroom, grab some more water. Always, by the way, always have water on you. The more water you drink, the better. So when I was in the hospital, they gave me one of these. One of these, it's like 28 ounces. So I don't know how many of these I drink a day, but I just keep filling it. And through the night, drink it as much as you can. You have to go to the bathroom quite a bit, which is a little bit of a pain because you're not supposed to bend or twist, but you got to bend sometimes. So anyway, my routine is that. So I try to get a little bit of sleep. I'll wake up, go to the bathroom, drink some water, maybe go upstairs to my secondary location with the recliner, do the same thing there, lay down, get comfortable, maybe another hour and a half, 2 hours. I'll wake up, I'll get up, I'll come back down, and then I'll go to the wedge pillow setup. So you never really get a full night of sleep. Surprisingly, I'm doing okay with it. My energy level isn't really that low. I don't feel super tired. I just feel like I didn't really get much sleep, but it's been working out okay. So just some advice on that. Think about your sleeping situation. Hopefully you're a better sleeper than me. Even without all this, I can't fall asleep to begin with, so I'm just not a good sleeper, I guess. Talked about the water. Make sure you always have water on you. Again, the pain. So let me talk through the roller coaster of pain. Overall, I would say not horrible. It's not horrible pain, but you will have pain in your traps here, on the sides of your neck, depending on where you had your symptoms. Like I was getting pain down my arm, but it comes and goes, and sometimes it lasts longer than other times, and sometimes you'll get it in your shoulder and your side of your arm, and really all you can do is either you're going to take the narcotics, which I'm not, or you just take some Tylenol and deal with it. And with the kind of pain I was in prior to this, I mean, this is a different kind of pain, but my tolerance level for pain is so high that it's not enjoyable, but I can get through my day and just forget about it. So figure out how you're gonna manage that and what kind of person you are. Are you gonna take the drugs? Totally fine if you do. Nothing against it. If you're not, then you just get some Tylenol Muscle. And I think I said this on my last video. The Tylenol Muscle works really well. There's 650 milligram tablets. You take 2 of those, and it works really well because all you're going to be able to take is Tylenol, no ibuprofen or anti-inflammatories. Speaking of that, so the drugs that they sent me home with, so Robaxin was the muscle relaxer, and they sent me home with Percocet. So those are the 2 drugs that I was sent home with. Again, I think I mentioned in the other video, like I only took it for like a day when I got home, and then I just stopped taking it because didn't like the way it makes me feel, and I guess I'll just tough it out. So hopefully in another week, most of this pain will subside, and the arm flaring up stuff hopefully will subside. I hope, because that's the goal here. That's the reason why we did this, is so we could get rid of all of the pain. So there's that. Okay. The next topic is walking. So I have been doing a lot of walking, and you got to ramp it up. So your first day or 2, you're not going to make it very far. I'm a runner. I thought, oh, no problem. I'm going to get out there and do a mile or so. My first couple walks were 3 miles or something. I had to turn back and come back because it takes a lot out of you. So just baby steps, take some short walks at first, work your way up. Again, I'm at day 7 and I just did 4 walks today. I'll do another one tonight. And each one of those was well over a mile, one close to 2 miles. So, I've already walked about 4 miles plus today, and I'll do probably one more 1-mile walk tonight. They say, walking is the best thing you can do. And so I suggest getting out there, get your AirPods on, listen to a podcast or an audio book, or take some phone calls while you're walking. Do whatever you got to do, but get out there as often as you can. I work from home, so my routine is I'll work for about an hour, I'll go for a walk, I'll come back, I'll rest. That is very important. Don't skip the resting period. Don't push yourself too hard. So I'll rest for at least a half hour to 45 minutes, maybe an hour, and then I'll do the routine again. I'll get back to work, I'll go for a walk, and then I'll rest. And sometimes I got to rest longer than others. Sometimes, 20, 30 minutes is fine and I feel better, but you're going to get wiped out. But it's good to get out there and get moving. It helps with everything. It's going to shake up your muscles quite a bit. So at the end of the night, it might be actually a little more painful than it was during the day. Like I kind of have some pain going on even here and on the side of this, on my left side of my neck. But overall, the movement is going to benefit you more than not doing it. So I highly suggest, do as much as you can, but ease into it. So that leads me to another topic, which is your low back. So for me, my L4, L5 has always bothered me my whole life. It's been manageable for me. Running actually really helps my low back. And we'll see how much of that once I'm able to run again, we'll see how much that helps. Hopefully it continues to. But regardless, it is still bad. So you're going to be sitting in positions it's going to bother your low back. Because a lot of times you're going to have to, the way you're going to lay, you got to have your legs elevated. If you're sitting up, or at least on an angle, you got to still have your legs elevated. You're going to want to do that. Otherwise, that angle is worse. So anyway, you're bending, your legs are going to be putting pressure on your low back. And I really thought that was going to be a problem. The first few days, I started to feel it. My legs started to hurt. My right leg started to hurt. And then my left leg started to hurt. And it was all from just being in these positions where your legs are elevated. The recliner with the wedge pillow set up, laying flat, you still have something under your legs, which overall is supposed to be better for you, and it probably is, but it's taken a toll on my lower back. So I was really nervous about that. But what I can tell you is the walking really, really, really helps with that. So if you run into that issue, just remember, if you're keeping up with your walking, that's going to help keep things loose. Plus, when you get done with your walk, you put some ice on your lower back. Sit in a chair, put some ice on your lower back. It really, really helps. Or if you're just going to sit down at night and watch some TV, put it on your lower back with however you're sitting. And ice can never really hurt. So that's really been my routine, and it's gotten a lot better. It feels a lot better. I still have some pain every once in a while on my legs. Like my right calf seems to be stiff whenever I'm sitting, like especially sitting in in the recliner or in an elevated leg position. I don't know why my right calf just seems to get stiff and it doesn't like it. But again, the movement will help you with that. So that's just a little tip. You're probably going to run into this unless you have an exceptional lower back, which maybe you do, and more power to you if you do. That's great. I don't, unfortunately. So anyway, so we're working through that, and hey, I've only got another month to go until maybe I won't have to deal with that portion of it anymore. Other than that, food. I mean, I think I mentioned in one of the other videos, like I only had like the sore throat or hard to swallow for like a day or two, and then it quickly started to subside, and I was able to eat like normal food within 3 days. I was able to get into normal food, but use this as an excuse to maybe eat a little better and think about what you're eating. So when I say that, like what I've done is, I've gone back to eating like steel cut oats in the morning because it's soft, and even though my throat doesn't really hurt, I figured, hey, I'm going to stay on this mantra. I'm also taking a supplement drink every day, to make sure I'm getting enough protein. Actually, it's probably still not enough, but I've got that. I also bought some whey protein that I can put in a smoothie, which I've yet to use, but I will use it. Just make sure you're getting like the right nutrition. And since you can't leave the house, you'll see that it's a little easier to manage your calories. I've noticed that. I have always had a problem with drinking too much soda, and I've been trying to kick it for a long time. Well, ever since this week started, we don't keep it at home, and I haven't had any soda, and I'm not really missing it. Well, let's be honest. I am missing it a little bit because I'm getting a headache from caffeine withdrawal, which kind of sucks, when you're dealing with all the other pain. But I figured, why not just knock it all out at one time? So that's just one of my goals, was to stop drinking soda, or as we call it in Chicago, pop, because I'm from Chicago. But anyway, so I would just suggest use this as an excuse to maybe eat a little better if you want to, but kind of reset yourself. I had a sandwich today. I made myself a sandwich with some turkey, and there's nothing wrong with that. You can do that, but just maybe make sure you have some healthier foods around that are easy to make. So you're going to have the Jell-O, of course. You're going to have pudding and things like that, because that might be all you can really get down, and that's fine. But I just used this as a time to, like, hey, maybe I can just focus on getting the right nutrition so that this can fuse properly. And maybe I'm doing a good job with it, maybe not, I don't know. But anyway, just another little tip there. What else? I think that's really it. That's all I really have to report right now. Again, all is going fairly well. If you're like me, you're going to be nervous about everything that you do. No twisting, lifting, bending is what they tell you. And trust me, you're going to go through these phases where you're like, oh, I can't believe I just twisted there. I just bended there. I just did this. I just did that. And it freaked me out at first. But again, like, there's situations where you just can't avoid it. And there's situations where you can. And I've noticed where I've naturally, maybe you just go to shut a door and you just swing it shut. Well, you're twisting when you do that. I've done that already multiple times. You got to keep reminding yourself, slow down, turn around, and push. You can push forward stuff. You don't want to be twisting when you do it. So you're going to make mistakes, and I've already have, and I don't think it's a big deal. I've called the PA, and she says, don't worry about it. You're doing a good job. So I don't know how strict it is, but I think if you're just constantly doing that, it could be a problem. Once in a while, I don't think is going to hurt things. But again, slow down, pay attention to what you're doing. That's it. That's it for today. Please leave some comments if you have any questions or anything. Again, I'm at a week post-op. I'll probably not do another video for 5 days. Maybe I'll just do week 2, unless something crazy happens that I want to report. But other than that, we'll see you in the next video. And thanks for watching. And we'll see you soon.